Hello friends, this is Gajanan Kata and today I will introduce to the topic of guidelines on pharmacovigilance. So, pharmacovigilance guidelines contain the following things or points: terminology in introduction, then adverse reactions, casualty, ICSR, seriousness, then active substances, medical confirmations. These are points in introductions of pharmacovigilance. Then the structure and processes. In that, collection of individual safety reports, unsolicited reports, spontaneous reports, literature reports, reports from non-medical sources, information on suspected adverse reactions from the internet or digital media, then solicited reports, validation of reports, follow-up of reports, data management, quality management, special situations, submission of individual case safety reports, report nullification, report amendment. The next point is the operation of EU network or U network. The management of individual safety reports for clinical trials, poor authorization studies, management of poor individual safety case reports for clinical trials, then management of individual case safety reports for non-interventional post-authorization studies, then non-interventional post-authorization studies, collection of individual safety reports, responsibilities of member states, responsibilities of the marketing authorization holder in the EU, spontaneous reports, solicited reports, case reports published in the medical literature, then the process of follow-up ICSRs. Follow-up ICSRs by competent authorities and member state of marketing authorization holders. Then the detailed guidance on the monitoring of the medical, when to start and stop searching in the medical literature, where to look, database searches, precision and recall, search construction, selection of product terms, then the selection of search terms, limits to a search, then record keeping, outputs, review and selection of articles, then the modalities for the submission of ICSRs in EU, modalities applicable to competent authorities in member states and to the marketing authorization holders, requirements applicable to marketing authorization holders, then the requirements applicable to competent authorities in member states, then the duplicate detection and management of ICSRs. Duplicate detection in UDRA vigilance, collaboration between the agency, commitment authorities in member states and marketing authorization holders. ICSR submitted to UDRA vigilance by the same sender and identified by the agency. Duplicate detection in UDRA vigilance, collaboration between the agency and commitment authorities in member states and marketing authorization holders. Then the duplicate detection in UDRA vigilance, collaboration between agency, commitment authorities in member states and marketing authorization holders. Duplicate ICS are submitted to UDRA vigilance by the same sender and identify the sender. Then organization prior to the detection by the agency. So friends, this is the guidelines of good pharmacovigilance. Thank you.